Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
The perfect cocktail. I'm Tara Prisco, physician assistant, and this is...
I'm Nicole Peniston, clinical psychologist.
So how's it going?
It's going. We're on episode 2, maybe. I don't know. It depends on which order we decide to put it in. But
I know.
We figured out all the glitches, and now we're ready to rock. It feels comfortable. It feels good.
And I have my mocktail. You have your cocktail.
Yes, I have my... We're ready to drink and chat.
Yeah. I mean, normally I'd have alcohol, but last night was my sister-in-law's 40th, and we went to a Russian restaurant, and lots of vodkas involved. And so I'm never one who did that hair of the dog thing where the next day somehow you feel better by drinking more alcohol. That never made sense to me. So I went for coffee, some liquid IV, and then now my mocktail to get me, plus some Tylenol and Motrin to get me back and ready to go for the day.
We're old. We can't bounce back like that anymore.
Seriously. No more nights in AC, staying up all night or in Vegas.
I don't know. I'm going to AC in December, so we'll see how well I do. Although, you know what? I went in February of this year, and me and my other friend, who is also in her 40s, we shut down the club. All those 20-year-olds left really early, and I was like, I still got it.
Were you dropping it like it's hot?
You know me, of course.
So
evidence of it.
So last night, of course, my kids were there too. This was their first experience of staying up late, like a nightclub-ish atmosphere. I don't know if you've ever been to a Russian restaurant, but there's half-naked women dancing in cages and singing, live singing, and then there's music. And
you
the
just
kids
told me what my next job should be.
Yeah, but the kids were down on the dance floor, and half the time they wanted to hang out with us, half the time they said we were embarrassing. I'm like, you don't even know.
They don't know what moves Mama's got.
My goodness. So what are we talking about today? I think we're doing music, actually, which was not an intentional segue. We're so good.
Yeah, it's so natural. It's seamless. We didn't even think about it.
All right.
So, yes. I'm going to be doing 3 different songs that all have the same theme, and the theme goes with the cocktail I've chosen, which is called the Tropical Depression. So I'm guessing you can figure out what songs I'm going to talk about.
We have a lot of punny names here, I'm sure.
Yeah, but a Tropical Depression is 1.5 ounces of light rum, white rum, not Jamaican or agricole. That's what this recipe says. 1/2 ounce of Jamaican rum, 1/2 ounce of lime juice, 1/2 ounce of simple syrup, 1/2 ounce of creme de banane, if you like that. And then, I'm sorry, not 1/2 ounce, 1/4 of an ounce of creme de banane, and 1/4 of an ounce of Fernet Branca, which I don't know what that is, but it sounds delicious.
And creme de who? Banana?
Yes.
Okay.
It's banana. That's what it says. I'm just reading. But essentially, you're making a banana daiquiri. That's what a tropical depression is.
Got it. Banana daiquiri. Okay.
And so let's jump right into my songs. So I picked 3 songs specifically from different eras and different type of genres, just to show that this topic, depression, is universal. I definitely could have been a little bit more wide-reaching in my choice of artists, but these are all songs that I also know, so I was a little biased on that one. But I'm going to start off with Paint It Black by the Rolling Stones. It came out in 1966, and I specifically chose that song because I feel like so many people have covered it. It's been in so many movies and TV shows and things like that people can already hear those opening guitar chords of it.
Right. Even my kids can recognize that one.
Yeah,
for sure.
It's been in so many places. I actually didn't know that it was originally done by the Rolling Stones. I thought someone else had done it. So I learned a little in doing my research on this. And so it is about depression, but it's more specific to that. It's more of depression associated with grief. So in the lyrics, what is being alluded to was that the lead singer, it's Mick Jagger. I don't know if it's really about a real life thing for him, but he had lost someone that he loved. And after being at the funeral, he feels like he sees everything is black, everything is dark and bad, and that he feels like he can't be around positive, happy things. So some of the beginning lyrics, I see a red door and I want it painted black. No colors anymore. I want to turn them black. And so here I did a little bit of a fall down the rabbit hole of searching lyrics, and it's alluded that the red door is supposed to be his heart, and his heart is turned black since this loss. A couple verses later, it says, I see a line of cars, and they're all painted black with flowers and my love, both never to come back. So he's at a funeral. You can imagine the funeral procession in those lyrics. And then later in the song, it's kind of like how he's trying to break out of this depression, but it's really difficult. And so he's trying to almost isolate, keep it to himself so that he doesn't bring down other people. It says, I see the girls walk by dressed in their summer clothes. I have to turn my head until my darkness goes. I want to see it painted black, black as night, black as coal. I want to see the sun blotted out from the sky. I want to see it painted black. So super happy song, super exciting. When I was doing some research on specifically that song, a lot of people made the assumption that it was about the Vietnam War. I think that was because of the timing of when it was released. But the Rolling Stones themselves, I'm not sure if Mick Jagger actually wrote it. It doesn't say it on this site where I found the lyrics. It just says by the Rolling Stones. But they have said that it was not intentionally about the war, but it did apply. And it said that actually, yes, Mick Jagger and Keith Richards wrote that song together. So it is their original song. So that's my first song. And then my second song is a classic, as I know, Tara, you will remember because it definitely was blasting during our high school days. Everybody Hurts by R.E.M.
Oh, yeah.
And I don't know about you, but for me, every time I think of that song, I really picture the video. Do you remember what the music video was about?
Wait, is this the one, people on a bridge?
Yes.
See?
Yeah.
It was so
So yeah, in the music video, it's a bunch of cars stuck in traffic and essentially like bumper to bumper, no movement.
Right.
People are stuck in their cars and they get out. And if I'm remembering correctly, I should have watched the video. If I'm remembering correctly, there is a car crash on the bridge and someone has died. And so people don't know that until, they're able to see that. But at one point in the video, everybody gets out of their cars and that's when they start to realize what happened. And I chose this song specifically because it's one of the few songs around that time anyway. The 90s, we were all very emo. We had a lot of feelings, a lot of negativity, a lot of anger towards stuff. But Everybody Hurts is actually an anthem against suicide. And so it's basically written to say that, we understand that people get depressed, they get really low, they want to give up. It's a human feeling. Everybody hurts, as the lyrics are, but to keep trying to work through that because it's worth it and that you can move through it even though it feels difficult. So some of the lyrics that express that, the ones that we all know, because there's very few lyrics in this song, which I'll get into in a minute, but the opening lyrics, when your day is long and the night is yours alone, when you're sure that you've had enough of this life, well, hang on. Don't let yourself go because everybody cries. Everybody hurts sometimes. So that's just the beginning, the first lyrics, but it repeats. And I bring that up for a very specific reason. I heard a while ago, and I don't remember the source, but I'll find it out and it'll be in the show notes, that song lyrics are very reflective of what's going on in society at the time. And so the more repetitive song lyrics tend to be, the more distress that society tends to be in a moment at that time when the song is released. And that's what makes it popular. So Everybody Hurts, even though there's several verses, the majority of them repeat, and it's the same thing over and over. But if you also think of other, more happy songs that are very repetitive, they tend to be released around a time and become popular around a time when, the country that it's released in is in a state of turmoil. And I think it's because of something very basic that makes sense to all of us. If it's simple and easy to remember and predictable, that feels safe. And so that's why it kind of appeals to us. So that was that song. And then I decided to come into recent times, relatively, with choosing a song from Billie Eilish, who also has very, very emotional songs. And it was hard to pick for her because she's got a lot of really good ones. But I picked the song Before I Go. Do you know that one? Because I had to look that one up.
I don't offhand. Maybe if I heard it. If it's not been radio play, I'm not like deep diving into albums because I don't know.
Yeah,
I don't have time for that.
It was on her debut album, released in 2019, but I think it was probably one of those songs. I mean, a lot of her songs from her first album got radio play and became popular, but that was one that didn't. But I will say when I looked it up, it sounded familiar. So I feel like it might have been in like a movie or a TV show or something like that, because it was definitely a familiar sort of song. And for this one, I chose it because it's kind of like a combination of Painted Black and Everybody Hurts, where it's somebody who's going through depression and they want to isolate and they don't want to be around people because they feel like not necessarily that they're toxic, but that like other people are not helping them. And so they want to isolate. And in this song, there is some allusion to considering suicide, but it doesn't kind of ends on a way like you're really not sure where she's going to go with this. And Billie Eilish has been open about talking about how a lot of her songs are influenced by her own mental health struggles, by depression, by anxiety. Sleep paralysis is a big one that's talked about a lot in her first album. There's several songs that allude to it. So maybe we can do that on another episode because that's kind of interesting.
Yes. And that has like more mythologic almost.
Yeah, I feel
The
like that's
incubus,
what
the
we could both
succubus.
cover, and there'd be a million things for both of us to talk about.
Interesting, yeah.
So in Before I Go, again, I said it's off her first album released in 2019. The album is titled When We All Fall Asleep, Where Do We Go? That's a pretty direct reference to sleep paralysis. But the beginning lyrics say, take me to the rooftop. I want to see the world when I stop breathing, turning blue. Tell me love is endless. Don't be so pretentious. Leave me like you do, like you do. If you need me, want to see me, better hurry because I'm leaving soon. Sorry, can't save me now. Sorry, I don't know how. Sorry, there's no way out. Sorry, but I'm down. So I think we kind of get the point. Sadness, feeling at a loss, wanting to end it all. And I pick these songs for a specific reason because as a therapist, a lot of people really struggle with being open and honest about suicidal thoughts, suicidal ideation, suicide attempts, and things like that. And I think back in the 80s, the 90s, probably even before that, there was a lot of ideas about how if we talk about it, it's going to make someone kill themselves. And we've learned, luckily, that's not the case. But I think there's still a lot of shame surrounding it. And so a lot of people don't want to talk about that. Or, I've personally, had rough times and had thoughts before. And when I've shared that with other people, they're kind of like horrified. Or they're scared on their own. They don't know how to respond. They don't know how to be helpful. And so they kind of freeze up and step back. But with my patients, I encourage them to talk about it. It's very normal. I think most people have those thoughts from time to time. It's when it progresses to planning or intention that we really need to work on a more structured intervention. There's no shame in that. Yeah.
Right.
It's a hard world to live in.
Yeah.
The fact that would make this cheers to both.
Seriously, those Gen Xers, we can handle it all.
Yeah.
Go Gen X.
Don't throw anything at us. We'll come for you.
Seriously, the amount of stuff I always say, my children's bullshit tolerance compared to what I dealt with as a child, it's like, you guys have never had anything sad. You've had everything you've ever needed in life. You've never had to worry about money, or your parents don't really fight much. There's that, it's just so yeah. So the littlest thing, they're like, ah.
But you know what? Our parents could probably say the same about us, and their parents the same about them. So it's every generation we adapt and we change and we get better. But I feel like something like depression is really universal. Everybody's experienced it. And so I get kind of happy when I see it in popular media, because it's like, okay, another person talking about it to try to normalize that. Yes, it's okay to feel this way. Yes, it's okay to ask for help. Yes, it gets better, because sometimes that can feel very trite. So it's good to have artists using their power in that way.
Yeah, I mean, as much as we can say social media is not good for society, I think the one thing it does is it does bring up, people have more access to talking about mental health. Absolutely. And normalizing it. If we just had news on the TV, it wouldn't reach people in the same way. So I feel and artists and people coming out and speaking on their own. And I just feel that's the one good thing about this time we live in.
Yeah, definitely. And I also think the good side effect of COVID is I think quarantine made a lot of people take a hard look at themselves and the way that they live their life and how they feel and how they take care of themselves. And so I think people are more open about that now too, because they realize, wow, life's too short. We should talk about stuff that's going on. We should talk to each other. We should check in with each other, and we're in this together.
Yeah.
That was super fast. Sorry. I mean, I could sing the songs for you, but you don't want to hear
them. I'm doing 3 songs that are unrelated to each other, and I may actually recite the lyrics. We'll see. We'll see how this goes.
Unless you want me to sing them for me, then just send me the lyrics. I'm happy. My instrument is ready.
One of them you can definitely sing off the top of your head. Okay.
Is it Britney?
So, no, completely different. All right. First, my cocktail. My cocktail is called A Spoonful of Sugar.
Love that.
I got the recipe from a YouTube person or site called Call Me Old Fashioned. So I actually have a mocktail of that I'm drinking right now. So I substituted the whiskey for brewed black tea just to make something else kind of rich in there. So in a cocktail shaker, you put orange marmalade or marmalade, however you want to say it, 1 teaspoon, 30 mLs of honey syrup. Honey syrup is essentially a 1-to-1 of boiled water and honey. Dash of ground cinnamon, 5 mLs. Now, this is not in ounces, this is in mLs because I think the guy was from the UK, of lemon juice, 50 ml.
Milliliters for those who don't know.
Yes, sorry, mLs. 50 mLs of whiskey, 20 mLs of orange juice. Stir it with a spoon, add some ice, shake it up. He said to double strain it into a rock glass. I just had the shaker itself strainer. I didn't have a special other one, but no chunks of marmalade got in there, so I think I did fine.
Good chunky drink.
But it is quite refreshing and sweet, but not like sickly sweet because it's like honey and juice, so it's not too much.
Nice.
Okay, but
did I ever tell you my issue with the word chunks?
I don't know.
I feel like
you have a fear of vomiting.
I do, but this is only slightly related. I feel like the word chunks should not be used to describe anything other than fruit.
Okay.
You just say pieces of meat. You don't have to say chunks of meat.
I get it. I see it. Chunks of fruit.
But chunks of does make me think of vomit.
And I know you have
a pineapple is not upsetting at all. So
chunks. Never thought about that word so much. All right.
For the aside.
That's why we're here. All right. So first one, we're bringing it back. Cat Scratch Fever by Ted Nugent. All right. So I'm going to read the lyrics. I'll try and give a little inflection. Well, I don't know where they come from, but they sure do come. I hope they're coming for me. And I don't know how they do it, but they sure do it good. I hope they're doing it for free. They give me cat scratch fever, cat scratch fever. Well, the first time that I got it, I was just 10 years old. I got it from some kitty next door. And I went to see the doctor, and he gave me the cure. I think I got it some more. They gave me cat scratch fever, cat scratch fever. I got bad scratch fever, the cat scratch fever. It's nothing dangerous. I feel no pain. I've got the choo-choo train. You know you got it when you're going insane. It makes a grown man cry, oh, won't you make my bed? Well, I make the pussy. I make the pussy purr with the stroke of my hand. Sorry.
This is the last episode of our podcast.
This has gotten very not so subtle. It is double entendres.
Syphilis?
No.
Toxoplasmosis? I'm confused.
Hold on. And he makes the pussy purr with the stroke of my hand. They know they're getting it from me. They know just where to go, and they need their loving man. They know I'm doing it for free. I give them cat scratch fever, cat scratch fever. They got a bad scratch fever, the cat scratch fever, and then repeat cat scratch fever 6 more times.
So I have 3 ideas about what it's about. It's either about heroin use, toxoplasmosis, or syphilis. Those are my 3 guesses.
None. Okay.
Oh, no.
All right. Well,
those not solid guesses, though.
I mean, yes, there are cats involved, but the cats he's describing are why I was laughing when he was saying I pet my pussy.
Well, that's why I said toxoplasmosis when I thought literal cats.
Okay. So this was written by the polarizing Nugent in 1977 and was released in May 13th of that year. It has electric guitar riffs, which helped make it very famous. It sounds like a stadium rock band similar to AC/DC. But the song, of course, is about sex. The cat being a thinly veiled metaphor for the woman and the fever being lust. Okay, but not the that's right, but that's not the medical tie-in. He explained the origin of the song in an interview with Ultimate Classic Rock. He had seen a medical journal in 1975, and he opened it up, and at the top it said cat scratch fever. I'd never heard of that before. What's that? So later on, the lick was cataloged in my memory bank. I went cat scratch fever, and I had fun with the lyrics. Okay, so in medicine, there's actually something that we don't refer to it particularly as cat scratch fever, but it's an infection with something called Bartonella henselae from the scratch of domestic or feral cats, particularly kittens under 1 year old. So there is actually something called cat scratch fever in medicine. Like I said, he was using I don't even think those were double entendres. Those were just straight out, I'm telling you what it is. He was obviously saying the woman, sex, kitten, pussy, the whole thing.
Sexually transmitted.
Right.
I was following him. I was picking up what he was doing.
So what happens is that cats can have fleas that carry this Bartonella henselae bacteria. and they get transmitted from a cat to a person during a scratch that's contaminated with the flea feces. So I guess on their nails from being in the litter box or whatever. Infected cats then can lick a person's open wound and can also spread the bacteria that way. So symptoms would be a low-grade fever and enlarged tender lymph nodes that can develop anywhere from 1 to 3 weeks after the actual exposure. And sometimes there's a papule or a pustule at the site of the scratch, so a little mark on your skin. Very rare complications. More in immunocompromised people can occur. Infections of the eye, liver, spleen, brain, bones, and the heart valves. More, like I said, immunocompromised because of chemotherapy, HIV, medications, things like that. They'd be more likely to get these serious symptoms. And the most serious would be infection of the heart valves called endocarditis. So it's interesting. It can be challenging to diagnose because often it doesn't grow out in the blood cultures when they collect them from the patient. And so the history definitely plays a role. Now, I've treated personally things from cat bites that can get very serious, and that's a different bacteria called Pasteurella multiseta. But I've never treated Bartonella, although I have tested people's blood antibodies for it in somebody who's got like a random lymph node that doesn't make any sense. So I have tested for it, but I've not had a positive in real life. I don't know, the incidence, but basically it's more, I'm not sure, I guess treat your cats for fleas and you're going to reduce incidence there. Be careful with feral cats because they're more likely to have fleas and more likely to have this. Have you ever had like a strange cat bite or scratch or anything like that?
So I used to have a cat and he only seriously bit me once. And when I actually did have to get medical help for it. But they just made sure I had my tetanus shot, which I had, and they just treated it, told me to keep an eye on it for infection. That was, he scratched me in the process of biting, but he was also an indoor cat. I knew that he didn't have fleas, so I don't know if they were necessarily looking for that.
Right, exactly. It's not the first thing. When I'm seeing people for cat bites, it's that other one, the Pasteurella. Yeah. And that one, you don't realize most people get actually bit on their hands because that's what you're playing with the cat, and you don't realize that your hands actually have a lot of what we call potential space in there. Like under the skin, there's places that infection can get very quickly and easily, and their teeth are so sharp. They're like little needles, and they essentially inoculate you with said bacteria, and then there might not even be a big wound, but within hours that can become an abscess and a streak up the arm like crazy. So that's the other one, Pasteurella, but just a little offshoot. All right, so I'm going to go on to 2 more other songs, brief like that. The next one, I think you'll have a little comments on. So A Little Bit Longer by the Jonas Brothers. So here are the lyrics. Got the news today. Doctor said I had to stay a little bit longer and I'll be fine. When I thought I'd be done, when I thought it all been said, a little bit longer and I'll be fine. You don't know what you got till it's gone, and you don't know what it's like to feel so low. And every time you smile, you laugh, you glow. You don't even know, no, you don't even know. All this time goes by, still no reason why. A little bit longer and I'll be fine. Waiting on a cure, but none of them are sure. A little bit longer and I'll be fine. But you don't know what you got till it's gone, and you don't know what it feels like so low. And every time you smile, you laugh, you glow. And you don't even know, no, and you don't even know. You don't even know, no, and you don't even know. And then it repeats one more time, essentially. And then the last verse is, so I'll wait till kingdom come. All the highs and lows are gone. A little bit longer and I'll be fine. So do you know anything about Nick Jonas?
I do.
Okay. Because I didn't
want to give any spoilers.
Yeah. I was not a huge Jonas Brothers person, but I hear their songs. Yeah. Yeah. So Nick Jonas has type 1 diabetes. So the one thing you could speak to a little bit is the sort of mental health struggles that go along with somebody with a chronic illness, or do they classify that more as an adjustment disorder, mood disorder?
It's hard because I know that there's actually a big area of mental health that works specifically to treat diabetes, because there's so much difficulty with mental health with compliance, with diet, with medication, things like that. So it is a big field, but I'm not really sure how they're classifying it. I'm assuming it would either be chronic adjustment disorder due to a medical condition, or honestly, in the DSM, everything can be due to a medical condition. So it could be anything, whatever the person's presenting with. But I would probably say closer to the mood disorders or the stress disorders.
Right. Okay. So basically, type 1 diabetes, Nick Jonas has this since he was very young. It can make you feel down or irritable. And the song speaks to his struggle with his disease. Per songfacts.com, he wrote it in an empty ballroom of a hotel when he was having a rough day. He states that he wrote this song in about 20 minutes while he was shooting the movie Camp Rock. So what is type 1 diabetes? You know, we talk about diabetes. Everybody's
Wait, we're not going to talk about Camp Rock.
I've never seen it. Sorry.
God, it's so good.
I'll put it on my list.
Yes.
So what is type 1 diabetes? You know, your pancreas essentially is not making either any or sufficient insulin. Insulin is very important. It's a hormone that helps your blood sugar enter your cells so they can be used in your body for energy. And without insulin, your blood sugar will continue to rise because it can't get into the cells, builds up in your bloodstream, and it becomes damaging to the body. It can cause many of the symptoms and complications of diabetes. Most patients who we talk about diabetes are going to have type 2, which is typically adult onset, although you can see type 2 also in children. But 5 to 10% of people with diabetes have type 1. So type 1, we used to call it juvenile diabetes, and we used to always say it only happened in children. Still mostly, but you can have what we call like a late onset type 1, which is somebody who may be in their 20s, has some sort of an inciting event, often a virus that essentially shuts their pancreas off. So we don't really know enough about how or why that happens. Genetic predisposition, environmental factors, lots of things that can go into it. But essentially, type 1 diabetes often presents, especially in children, as an emergency. What happens is the child becomes extremely lethargic because we don't know they have diabetes. They're just all of a sudden they're not feeling well. And they end up in the hospital often with something called diabetic ketoacidosis, which is very much an emergency. What happens is when so much sugar is high in your blood, it causes a shift in your electrolytes. So your potassium gets thrown off. You become what we call acidotic because it builds up of ketones. Ketones come out when your body's sort of in starvation mode. So even though you have all the sugar in your body, you're not able to use it or access it. So you're essentially in starvation mode. Often you're very, very thirsty, urinating very frequently, very, very, very fatigued and lethargic. And so you need to be hospitalized to have all those electrolytes normalize and get the patient on insulin. So pills are not an option when it comes to type 1 diabetes, only insulin, because the pills, what they do is they often stimulate your body to either use its insulin more efficiently or to make more. In this case, that won't work for you. So it's a lifelong condition. It can be managed. Nowadays, we have so much more technology. We have these continuous glucose monitors, things that will have alarms that'll go off if your sugar is going too high or too low. So we live in a great time for patients who are diagnosed with this. But it's different. It's something that, like I said, it's not the common, oh, my grandma has diabetes. This is something that is fairly rare and is pretty intimidating as far as treatment goes. I won't treat type 1. Endocrinologists will mostly manage them, because it's a lot more complex than some of the patients with type 2 that I'm used to. So let me take a drink because I'm getting a tickle in my throat. And so my drink, Spoonful of Sugar, actually speaks to that, but also speaks to the next song.
Ooh,
which is A Spoonful of Sugar by Mary Poppins / Julie Andrews.
I've heard lore about the meaning of this story, but I can't wait to hear.
Okay, so A Spoonful of Sugar. You can sing if you want. I will not sing. I do not sing. A spoonful of sugar helps the medicine go down, the medicine go down, the medicine go down. Just a spoonful of sugar helps medicine go down in the most delightful way. In every job that must be done, we find an element of fun. We find the fun and snap, the job's a game. And every task we undertake becomes a piece of cake. A lark, a spree, it's very clear to see that a spoonful of sugar helps the medicine go down, the medicine go down, the medicine go down. Just a spoonful of sugar helps the medicine go down in a most delightful way. A robin feathering his nest, he has very little time to rest while gathering his bits of twine and twig. Though quite intent in his pursuit, he has a merry tune to toot. He knows a song will move the job along. Oh, a spoonful of sugar helps the medicine go down, the medicine go down, the medicine go down. Just a spoonful of sugar helps the medicine go down in the most delightful way. And then repeat, said last verse. So when they were actually looking to come up with a song for Mary Poppins, they were looking for a phrase or something that was catchy. So they thought about an apple a day or a stitch in time. Those were things that they just really weren't in love with. So it was the Sherman brothers who were actually trying to write this. And Robert Sherman's then 8-year-old son came home from school one day, and he said to his son, "How was school?" And he said, "Great, we got the polio vaccine today." I said, "Oh, did that hurt?" He said, "No, they just stuck the medicine on a lump of sugar." And that was it. That was the eureka aha moment, and a spoonful of sugar made sense for the song. So is that what you were predicting was?
Yes and no. I knew that it was related to like taking a medication, but I also know that a lot of drugs have been administered by cubes of sugar as well. Like when it was straight absinthe. I mean, when you still make it, you make it with sugar. But I know in the past, like heroin, things like that, well, opium back then, it was also administered with sugar because I think it left a bad taste in your mouth. So that was why they did it.
Got it. So yeah, I mean, same idea. Polio was given on sugar. It was the polio vaccine is an oral vaccine, so not an injectable. It was made by Albert Sabin, and it has a bitter, salty taste. So they made these big efforts at the time to try and get as many children vaccinated as possible. So they actually did it in schools, churches, the hospitals, and they would line up and essentially they would give them a little cube of sugar or a spoonful of sugar with the medication. And it was, it was an interesting way to get it done. And, it worked. Obviously, we've eradicated polio. So, but there's some other uses of sugar in medicine that I thought were a little bit interesting. So growing up, whenever my sister or I had hiccups, my father would always say, "Here's a spoonful of sugar. It's going to fix your hiccups." And, with hiccups, we talk about holding your breath, drinking water. I think Laura, our mutual friend, used to drink water while hanging upside down from the other side of the glass or something like that. But honestly, the spoonful of sugar worked with a high success rate. And I even use it on my own children. I've been places and they have hiccups and I go to the front desk and be like, "Do you have a packet of sugar?"
But
they look at me like,
just a muscular contraction, like a muscle spasm.
Yeah. So I didn't really know this was a real treatment until when I was first working my first job in urgent care, and an well-seasoned emergency room doctor. Shout out to Dr. Pollack. Not sure if he's still around and practicing. But he had mentioned in passing that he used sugar for hiccups for patients, and he had many years experience in the emergency room for this. So hiccups are just involuntary contractions of your diaphragm. Your diaphragm's the muscle below your lungs that helps you to breathe in and breathe out. When you hiccup, your diaphragm suddenly moves down, forcing you to breathe in, and your vocal cords, your glottis, closes and gives you that hic kind of sound. Typically, they do go away. I don't know. One of my children seems to have hiccups often and long. I think it's phased out a little bit lately, but some people just get them a lot.
Are people commonly going to the ER for hiccups?
So you can get intractable hiccups.
I feel like I remember that on a talk show, the girl who had hiccups for 40 years or something crazy.
Yeah, I mean, it can happen from eating too quickly, carbonated beverages, being excited, alcohol, temperature, spicy foods, but some other medical conditions can cause it, like acid reflux, shingles, brain damage, Parkinson's, stroke, MS, electrolyte imbalances, and surgery of the abdominal or chest area, because your vagus nerve is what controls that diaphragm. So any irritation or inflammation of that vagus nerve can cause it. And then some medications can actually cause it, chemotherapy, drugs, and anesthesia and things like that. So it can be a true medical thing. We think about, whatever, it's hiccups. But if you can't sleep because you've had hiccups for days, I guess eventually you might go to the emergency room. So the way that the sugar works is it irritates your pharynx, which is your throat, and your uvula, the little hangy ball in the back. And it helps your vocal cords to relax. And it also causes a brief distraction for your body to focus on. And the feeling of the sugar granules can stimulate your vagus nerve, which we spoke about, which controls the diaphragm. And so it's definitely an option. It's pretty low risk, not invasive. So why not?
If you have diabetes.
Yeah, but one little spoonful shouldn't throw you over the edge. But yeah, there are some other actual pharmacologic things that can be used. There's only one drug that's technically indicated for intractable hiccups, and you may be familiar with this one, chlorpromazine.
Oh, yeah.
Chlorpromazine, which is an old antipsychotic medication treating schizophrenia, bipolar, acute psychosis. It's technically the only one that's FDA approved, but it's not actually the one we use first line because I think risk benefits.
I was going to say there's high side effects for that.
Yeah. So first lines would be baclofen, which is a muscle relaxer, or gabapentin, which is a nerve pain medication. And then in the backup reserves would be the chlorpromazine or metoclopramide, which is an anti-nausea medication. But I say try sugar. I mean, it works.
And it's everywhere. It's easy to
Right.
find.
It's easy to find. And your kids won't fight you on it when their hiccups are getting annoying and you're like, here, have some sugar. And I'm going to give you one last use for sugar, which is way out there, but true. So do you know what a prolapse means? A prolapse of anything.
It's like when something like falls down.
Right. So it's any organ that sort of falls out of place. And if you kind of think about it like a sock going inside out, if that makes sense. So a vaginal prolapse, a rectal prolapse.
That's the one I've heard of is vaginal prolapse.
You can have
childbirth, right?
Right. Or just you get
in general,
old and things fall. You can also get, if you have a colostomy, so that's when you had part of your colon removed and you have that opening, it can sort of come out further than it should. So where sugar comes in is a rectal prolapse. A rectal prolapse can happen because of previous surgery, because of poor muscle tone in your pelvis, because of increased straining. I don't know the joke.
My ass falling out?
Yes, that is basically what it is. So here's where sugar comes in.
You just put it back up in there?
If you can't manually reduce it with your hands, which, can be done, but if it's really angry, it's been stuck out there for a while, and if something gets more angry, the more you push on it, it's going to swell more, right?
Is it painful? I would imagine it must be.
It's not, I think it depends, because if your muscles are so just and everything's falling out, it's not, it's just kind of hanging there. But if you're messing with it or it's stuck or whatever, you're going to end up seeking care. So you sprinkle sugar on the area that's outside the body that's prolapsed. And because it absorbs some of the water, like osmosis from the tissue shrinks up and goes back in easier.
I just got a visual of pouring salt on a slug.
Yes. Essentially same idea, but I've heard of this used for sure, really in medicine, in an emergency room, in something else, more than putting someone under if you can do it that way rather than putting someone under anesthesia and surgery and trying to do it, like it can still come back out. But in that acute setting, when you just want to get it back in and get the person comfortable, it's an option. So if your butt's hanging out, put some sugar. Not medical advice.
Put sugar on it and everything's
not medical advice.
Got it.
We did it. We did 2 episodes. We are amazing. Tooting our own horn and all that.
Playing some songs for you guys. I'm so proud of myself. I didn't sing once.
I really kind of wish you sang, though.
Maybe in a future episode, we'll see. Give it all away in episode 2. Come on.
True. We have more coming. I definitely already have another episode written that you're going to have fun with.
I can't wait. I don't, so let's prepare that.
It's fine. I just got obsessed in my head about certain topics and I just deep dived into them.
That's cool.
So shoot us an email, medicalmediamixer@gmail.com. Follow us on Instagram at medicalmediamixer. And follow, rate, subscribe, all those things that are happy and good and make us happy and good. Shoot us some ideas for topics, and hopefully we will see you back again.
Bye, guys.
Bye.